Again, this is Bridget Wall Lennon, and I'm with B.L. Wall Consulting, and we are one of the sub-consultants to Griffin and Strong, who is conducting the disparity study for Wake County. This is the third public hearing for the Wake County disparity study, and I'd like to welcome each of you to the public hearing and just thank you for your interest in Wake County's disparity study, as well as providing feedback to us regarding your experiences in having worked with Wake County government or attempted to work with Wake County government. So by way of introduction, I'll just go ahead and just indicate that we are recording, excuse me, this public hearing. And so none of your personal names will be used in relationship to the disparity study, but maybe some of the comments that you share with us might be used in the anecdotal chapter of the disparity study. And so the format for this afternoon's public hearing is just to kind of take you through a very quick presentation, just to kind of give you an overview for those of you who may not be familiar with disparity studies, to kind of walk you through what that process is and what it looks like. And so before we get started with that, I would like to acknowledge that we have Kadia Troublefield, who is on the line, who is the Deputy Project Manager for the Wake County Disparity Study. So she's on the call, as well as Vanessa Powell, who is a business program coordinator for B.L. Wall Consulting. And so she'll be helping as we facilitate today's call and pretty much taking notes as we proceed through with the presentation. So I will go ahead and Kadia, if you have not made me a host, if you can facilitate that for me, I will go ahead and, okay. Okay, great. So I cannot see the screen. All I can see, I can't see your faces. All I can see is the presentation, but is this showing on the screen? Can somebody unmute and let me know, please?
No, I don't see it, Bridget.
Is that Angie's voice?
It is. Hi there.
Hello, Dr. Arrington. How are you?
I'm doing great.
So, good. And again, hello to everyone on the call. Let me do one more thing. Okay, share screen. Here we go. Kadia, before we get started, could you unmute, please, and let me know if I need to not necessarily take roll, but ask everyone who is at the public hearing to indicate who's on the call?
Yes, ma'am. That would be great.
Okay. So before we get started, let me just stop sharing the screen for a second. I'm going to call you as I see you on my screen. If you would please unmute and say indicate who you are, your name, and the company that you're with. Okay, so I see Sandra Miller.
Hi, I am with Adara Spa.
Sandra Miller. Could you spell that, please, Ms. Miller?
A-D-A-R-A.
Adara Spa.
Yes, Adara Spa.
Okay, are you located locally?
Yes, Raleigh, Peace Street, across from Starbucks.
Okay, NC. Okay, great. Thank you so much.
You're
Denise Hargrove.
Hi, Denise Hargrove, Hair Designs by Denise, Raleigh, North Carolina.
Okay, thank you so much. Hair Designs by Denise. Thank you, Ms. Hargrove. Okay, Dr. Angie Arrington.
Good afternoon, everyone. I'm Angie Arrington. I go by Dr. Angie. My company is Evolve Consulting. We are out of the Raleigh area, specifically in Knightdale, and I am delighted to be here.
Okay, great. Okay, let's see here. The squares are moving around. Georgina Neteru, and I apologize that if I messed up your last name.
Hi, I'm Georgiana Dorito. I'm with Country Day Montessori School in Raleigh, North Carolina.
Country Day Montessori. Oh, okay. Let's see, who am I missing here? Okay, Mayim Ellis.
Hi, my name is Maima Ellis, and I am owner and operator of Little Footsteps Childcare. I am a family childcare provider in Raleigh.
Okay. What's the name of the company again, Ms. Ellis?
Little Footsteps,
Little Footsteps, Little Footsteps.
yes, Little Footsteps Childcare.
Okay. And last but not least, Ms. Cheryl Merritt.
Good afternoon, everyone. My name is Cheryl Merritt. I'm the CEO of New Legacy Realty, which is a full-service real estate brokerage firm here in Raleigh, North Carolina. Thanks for having me.
Okay, thank you so much, Ms. Merritt. Full disclosure, we are also in the process of conducting focus groups for the disparity study. So if I inadvertently say focus group instead of public hearing, just thank you for putting your information in the chat. Just know that we're in the process of doing those as well. But this is the public hearing, the third public hearing, as a matter of fact, for the Wake County disparity study. And as a lead off, Ms. Arrington, Dr. Angie put her contact information in the chat. If you all don't mind doing it, that would be so very helpful. We're trying to take notes and spell the names correctly as we see them on the field, but it will on the screens. But once we download the recording, then we will be able to download the chat as well. So that would be helpful. You'll just put your contact information in the chat. So I will go ahead and get started very quickly because I value your time. Okay, so now is my screen showing?
Yes, and it's very beautiful.
Oh, well, thank you. I can't take credit for it. I think Cordelia can. So we'll just go ahead and move forward. So as I indicated, this is the Wake County Disparity Study, 2023 Disparity Study. This is the county's first disparity study. So just a little bit about Griffin and Strong. And I've got to figure out how to move my, screen. So there you go. Okay, my Hollywood squares was showing up on the presentation. I couldn't see. So just a little bit about Griffin and Strong. Griffin and Strong is a law and public policy consulting firm based in Atlanta. The company specializes in disparity research, contract compliance, and supply diversity implementation. And what makes Griffin and Strong so unique is that the company has over 30 years experience in doing disparity studies. None of the disparity studies have been challenged or overturned in court. And we like to think that the Griffin and Strong team is unique and brings a very strong perspective to this line of work because the company has 4 Juris Doctors, 2 PH economists, a PH in social psychology, and a PhD in anthropology. Before I leave the screen, the president and CEO of Griffin and Strong is Rodney Strong, and Del Marie, his wife, is also in the business, as well as their daughter, Amani Strong, and she's the CFO. Some of you who might be familiar with disparity studies and minority and women business programs might know of Rodney Strong from having worked for the city of Atlanta and having set up the city of Atlanta's, he did a lot of work with the city of Atlanta's program and pretty much facilitated a lot of work around disparity study when he was in the city of Atlanta's MWBE office. So you might ask, what is a disparity study? Disparity study is an objective research tool that determines whether or not there are disparities in governmental agencies' procurement activities for certain groups. And if there is disparity and there's a statistical significance that might be caused by gender or race, then when you do a disparity study, and if that is the case, it allows you to put into place some remedial activities that can help bring parity to the gap that might exist between the different categories that you're looking at. So disparities are determined through quantitative, which would be statistical, as well as qualitative anecdotal evidence, as well as the review of current policies and procedures. So this particular public hearing, as well as the focus groups and some of the one-on-one types of interviews that we'll do with business owners about their experiences in doing business, in this instance with Wake County, or attempting to do business with the county, is considered a portion of the anecdotal evidence. And sometimes that anecdotal evidence might help us tell the story of the quantitative information, meaning the statistical information. Sometimes the anecdotal information will help us tell a better picture about what the numbers are saying. So why do we conduct disparity studies? Well, a disparity study is the factual basis for remedial contracting programs. And so there are three major court cases that kind of facilitate what we do when you do a disparity study. And the first case was the City of Richmond versus J.A. Croson. That was in 1989. Adirond Construction versus Pena. That was Secretary of Transportation for the U.S. Department of Transportation, Secretary Pena. And then H.B. Rowe versus Tippett. And the H.B. Rowe Tippett case was actually a case that was adjudicated here in the Fourth Circuit in North Carolina. And Tippett was the former secretary of the NCDOT Transportation, Department of Transportation. And so when you conduct a disparity study, the courts have said that you have to have strict scrutiny for race-based programs. And you have to have intermediate scrutiny for gender-based programs. And so again, the disparity study gives you the factual basis or the factual foundation in evidence to say that there's a need to have these remedial programs where you're looking to try to bring parity in contracting, in particular in public sector. And then the methodology is dictated by case law. So when we have had these suits that have been brought and the courts have looked at programs across the country, they've looked at what the methodology was in determining what disparity evidence came up with. And so they kind of guide what our methodology is when we do a disparity study. And so just to kind of take you through the process of when we conduct a disparity study. So we do a legal analysis, meaning we will look at that particular entity's contracting and any type of legal ramifications that might impact their contracting and procurement. So we'll also look at any type of, do a legal analysis of laws for that particular state or jurisdiction that might impact that particular entity's procurement and contracting. Then we'll do a policy review, wherein we will look at, we'll request documents from that particular entity and take a look at what their policies and procedures are around procurement and contracting. And as part of that policy review, we also will interview some of the management team to get a better understanding of what their understanding is around the procurement policies and procedures for their respective organizations. And the policy review also allows us to kind of glean and determine whether or not there are gaps in what is taking place that might render recommendations at the end of the disparity study. The third thing we do is we collect and clean data. And so we have a meeting with the leadership team for that particular jurisdiction, and we will request the data dump, request information from them, and go through and then clean that data so we can do an analysis on the data. And then we do a relevant markets analysis where we take a look at what's taking place in that particular marketplace. And then we also would do a utilization and threshold analysis where we will look at the utilization of the businesses who are doing business with that particular jurisdiction. And then the sixth step is to do availability analysis. So you'll take a look to see what is the availability of business firms, contractors, service providers in the market to determine what the availability is for that particular marketplace. And then 7 leads to the disparity analysis where you compare the utilization versus the availability so that you can determine if there is in fact disparity, not only for the various categories, which might be African American, Hispanic, Native American, Asian American, white female, but also in various categories, whether it's goods and services or construction. And so that disparity analysis allows us to determine what, if any, disparity exists in those particular group categories as well as procurement and contracting categories. And then we do a private sector analysis to look to see what is taking place in the private sector so that you can determine what impacts or influences might be on a program based on what's happening in the private sector. And then the ninth step is the anecdotal evidence collection and analysis. And as I indicated earlier, when we're talking about anecdotal, we will do focus groups, we will do public hearings, we do a survey where we send out a survey to all the business firms that we're able to glean from the various databases, whether it's the Hub Office's database, NCDOT's database. We use Dun and Bradstreet, just different methods of collecting vendors' registration lists, even for that particular entity. For example, with Wake County, we also requested their vendors list, and we send information out to these business firms so that they can provide information and feedback to help substantiate the anecdotal evidence. And then the 10th and final step is to do a final report with our findings and then provide recommendations. And if you all have questions, feel free to jot them down as we're going, and I'm happy to try to answer any questions. And if I can't, then we will pivot and ask Cordelia if she's able to help out some. So next slide. This gives you a projected timeline for the study. So we started the study in the spring of 2022, where we worked with the initiation phase, where we finalized the work plan and did the data assessment and kickoff. And then this summer, we started with an informational session. We launched a website. We also did the policy review. B.L. Wall Consulting worked with our in-house statistician and lead investigator, Dr. Vince Egan, and conducted policy interviews of key procurement and managers within Wake County. And then we also did a quantitative data collection, where we asked them to provide information on what their spend was for the procurement study years. And then we started the anecdotal interview collection process. We launched the online survey. We probably sent that survey out to 8,000 plus individuals to give them an opportunity to provide feedback. And then we started the data analysis preparation. And then in the fall of this year, a couple months back, we started our survey, had those completed. We started the quantitative data analysis, trying to make sense of the data that we had collected. And we also started the anecdotal completion of the anecdotal interviews, which were the one-on-one business interviews, focus groups. And we're finishing up this week with the last focus group, which will be on Friday, as well as today is the last public hearing that we have scheduled. And then going into January and February of next year, as we are finishing up the report, then we will complete the quantitative data analysis. We will draft the report, send it to Wake County for their review, and then come up with our final report and presentation. So as we look at the community engagement and anecdotal evidence process, we start out with informational meetings where we just kind of give an overview, and we also give a presentation to those individuals who attend the informational meetings to kind of let them know this is what the impetus of a disparity study is. This is the foundation of what we end up doing, and kind of walk them through that process of what a disparity study is. And then another piece of the community engagement and anecdotal evidence is the anecdotal interviews. We conducted 30 one-on-one business interviews with business owners in the various categories: Hispanic, African American, Native American, Asian American, and white female, and then minority-owned businesses. We do a survey of business owners where we allow the business owners to provide feedback. We have prepared questions that we ask, but then we have an opportunity for them to provide any feedback that they think might be helpful to us as we are working and preparing this disparity study. Again, we have public hearings. This is our third one. We do organizational interviews with some of the trade associations, the Hispanic Contractors Association of North Carolina, some of the MWBE Coordinators Network, some of the organizations that are impactful or advocates for minority and women businesses. And then we also as part of our anecdotal research and engagement, send out emails and social media. We glean information from those as well. So how can you get involved with the disparity study? Well, just as you have done today by signing up to be a part of the public hearing. And also some of you may have been contacted for anecdotal interviews or focus groups. And hopefully you've had an opportunity to complete the business owner surveys that we sent out. We sent those out. Just may have seen a lot of emails coming through trying to encourage the business owners to complete the surveys and provide their feedback. But you can always, if you weren't called upon to participate in the anecdotal interviews or the focus groups, you can email it comments to this designated website, and I will ask Kadia to put that in the chat as well, so you can copy it if you would like to provide some one-on-one information in a confidential manner outside of this public hearing. Okay, so this slide is a little bit out of order, it seems like, but I will go ahead and just tell you, since we've gone through the presentation, what the purpose of the hearing is, and that is to hear candid testimony about your experiences, whether they're positive or negative, in doing business or attempting to do business with Wake County government. And so we know that there are other entities located in Wake County, whether it be the city of Raleigh or Wake County Public Schools, but we really would like to be able to zone in and key in on Wake County government, if at all possible, if you've had any experiences in doing business or attempting. And then if not, we're glad to get other feedback from you in general about some of the challenges that you might face as a business owner. But first and foremost, we're going to focus on Wake County government. And then for a disclaimer, like I indicated earlier, everything that you say during this public hearing will be available for public record. But again, as I indicated in our final report, we will not publish any names, any business names, or any other affiliations of individuals who gave testimony or input in today's public hearing. And again, in terms of the process, we're not soliciting questions, but commentary only. Additionally, we will not be responding to questions or commentary other than to try to gain additional clarity to your comments. So, in terms of public comments, when providing comments, please begin by stating your name and your business name clearly for the record, and then you may provide or proceed with your testimony or comments. And you can connect with us via Facebook, Griffin and Strong, Twitter, and the website. And I will also ask Cordelia to put, Cordelia or Vanessa to put the study's website in the chat, so you cut and paste that as well, because I'm going to stop sharing my screen shortly so that I can see everyone's face on the call. So before I leave the presentation, I'll just pause here and ask if there were any comments or questions regarding the disparity study process.
Hi, I have a question, and I may have missed it, but I was just finding out if there was anything that precipitated this study. Was there an event or an issue that caused this study to be requested or come about?
Okay, so typically when you have a program like the county or the city of Raleigh, where it's like in their cases, this MWBE program, is a program based on race, or whether it's the state of North Carolina's HUB program or NCDOT's Disadvantaged Business Enterprise program, the courts have indicated that you should have a disparity study to first determine if you even have a factual basis for having a program in place that is focused on race. And so that's why you see these municipalities moving forward with having disparity studies. So you just can't say you're going to have goals because you have a 30% population. And I'm just kind of putting this in a example type format so you can understand, hopefully you can understand. So you can't say that we're gonna have 30% goals for minority and women business participation because you have 30% Black population or Hispanic population. You have to do a disparity study and you have to look at businesses in your relevant market. And that relevant market might be Wake County and then the surrounding counties that touch it. Or like for the state of North Carolina, the relevant market was the whole state because people in the state have access to do business with state agencies. And so you have to have that disparity study to give you that basis to have a program where you're trying to bring, if there in fact is disparity in contracting, then this study then gives you the basis that you need to say, okay, we're going to put some program initiatives in place to bring parity to those areas where we found disparity in contracting. And so the county had not had a disparity study yet. The city of Raleigh, and so you had external individuals and internally pushing for the elected officials to have a disparity study so that folks could find out where the county was in terms of their contracting with minority women and small business firms. And then if there is disparity, then to be able to put some program initiatives or processes in place that will increase participation.
And one more question in addition to that. I did receive the survey that asked, do you feel like your race has played a role in you receiving or not receiving a contract?
Mm-hmm.
How do you determine between what someone feels and an actual fact? How do you determine what is someone saying, oh, I feel like, the city cuts me out of deals versus I have proof that someone has cut me out of a deal?
Yeah, well, when you're doing the anecdotal research, it's based on one's experiences. And so it might be your experience that you feel or you believe, whatever it is, whether or not you are getting information, you're not getting information, whether or not you have bid on a project or submitted a proposal and you believe that this is what happened, or you believe that you experienced something discriminatory or your experience was. And so it doesn't have to be factual. It's what your experience is or was in this anecdotal phase. But what tends to be factual is, and that doesn't go to say that what you're saying isn't factual because it's your experience. But then, as I was indicating, we use the anecdotal research to help tell the story of what the numbers might look like. So if you have really high numbers, then it might be that when you do these anecdotal, the anecdotal piece that you have people saying, hey, we get lots of information. That particular entity does a really good job with outreach. They do a really great job with networking. They provide a lot of supportive services. So those might, be some of the things that you gleaned from when you do the anecdotal piece of it.
Got it. Thank you so much.
You're welcome. I hope that was helpful.
It was.
Okay, great. Anyone else have any other questions about the disparity study, the process, the timeline? Okay, well, if not, I will now open the floor for each of you, if you would like to provide any type of testimony, any type of feedback or comments regarding your experiences in doing business or attempting to do business with Wake County government. And let me just say, you don't necessarily have to stay on the call for the duration of the public hearing. You are more than welcome to give your testimony or give your feedback. And if you need to drop the call after that, that's fine. We'll be here for the duration, but just, hopefully are here in this virtual public setting. Had we been in person, we do the same thing. People might come in, give their feedback and leave. But so Dr. Angie.
So good afternoon again, Ms. Wallen, and thank you for the overview of the purpose of the study and for conducting this virtual public hearing. I decided to take time out of my busy schedule to chime in today because I have found it quite difficult doing business with Wake County or attempting to do business. I've not been successful. And while I know that I don't know it all, I believe I'm pretty professional in how I present my business capabilities, as well as proposals and or follow-up, attending networking sessions and meeting people, doing all those things that we all know are necessary to do business with any entity. And being a resident of Wake County, it has been quite challenging to get a foot in the door. I meet a lot of non-minority women who seem to have the business on lock, at least in my capabilities area, which is management consulting, training, etc. And some of them have even shared with me the very lucrative hourly rates that they receive. When I did receive feedback a couple of times over the past 4 years, I was told that my rate was really high. Yet this woman who does not have melanin in her skin was getting almost 3 times the rate that I quoted. And when I questioned it, she indicated that there was no issue for her. So I just feel like if we don't stand up and speak out about our experiences, nothing may or will change. And so in response to the lady who asked the question about what precipitated, I think that's Ms. Miller, what precipitated this disparity study, I think that the fact that we still do not live in an equitable world when it comes to how we are treated or experience things as people of color and as women. And so I stand today on behalf of African-American women and the plight that we have with difficulty to having access to capital to run our businesses, the difficulty we have with getting our foot in the door and breaking that ceiling of still a very much old white boy network that keeps us out or causes it to be non-inclusive for us. And so I just wanted to stand and be represented that this is great work that you are doing, that the county is doing. And, I do acknowledge I have not spoken directly with Danya Perry, who I know and respect as someone who is fighting the cause for DEI, BQ, and whatever else we add to that, right? So no shade, Danya. I'm talking about before he arrived and got in the role that he's in now.
Okay.
It is definitely work to be done for us. So I'm also grateful to see all the sisters that took time today with the different businesses that we're running. It's so hard to balance working in the business and working on the business. So I decided to work on my business today and speak out about my own experiences and hoping that it will make a difference for me and other women of color and people of color.
Dr. Angie, thank you so much for that. I just wanted to ask a clarifying question. So when you talked about the discrepancy in rates, do you know, was that for a bid or a proposal or work solicitation that you were pursuing for Wake County government?
I cannot say that it was for the same bid specifically that I had bid on. I do know that it was for the same type of work. It was for management consulting work specific to training and executive coaching.
Okay, but it was for the county?
Yes, it was for the
Okay.
county.
Okay, great. Thank you.
You're welcome.
So for those of you who have joined, I see 2 other individuals who joined the public hearing. Again, this is the 3rd public hearing for the Wake County Disparity Study. I'm Bridget Wall-Lennon with BL Wall Consulting, and our consulting firm is partnered with Griffin & Strong to conduct the disparity study for Wake County. And So this is part of our anecdotal process in the disparity study to provide business owners with the opportunity to provide feedback on their experiences in doing business with Wake County or attempting to do business with Wake County. So I see Ms. Merritt's name, hand raised. I'm going to come to her in 1 second. But before I do, and before these individuals drop off, Ms. Merritt, if you'll just hold tight for 1 second. Ms. Harvey, Alicia Harvey, do you mind unmuting and just letting us know what business you're representing this afternoon?
Hi, thank you for just a moment. Hello to everybody. Alicia Harvey. I own a real estate investment firm. It's called Premier Real Estate Service. I'm also a real estate agent. And so I do both of those. I will say I have not done a lot of business in Wake County. I do a lot more business in some of the rural communities. I got into real estate because I wanted to provide affordable housing for low-income communities. And so through this vessel, I've been allowed the privilege to be able to do that.
Okay, great. Thank you so much. And Mo Johnson. Would you please come off mute if you don't mind and just tell us who you are in the company that you represent?
Are you speaking to me, Mo Johnson?
Yeah, Mo Johnson, yes.
Yes, I'm in my 8th period, I'm sorry.
Okay.
This is Mo Johnson, and right now I'm teaching social studies, but currently I'm also the director at Garner Road Community Center.
Okay. Garner Road Community Center. Okay, thank you so much, Ms. Johnson and Ms. Harvey. So, okay, and so just to let you all know, we are recording the public hearing, as I indicated to the participants earlier when we first started. We will record this so that we can go back, and if we need to kind of check and make sure we did our transcription and got the essence of what you're saying, we're able to do that. But none of your individual names will be used in the disparity study, although some of the information that you share with us might be used, but not your names or your business names. So, Ms. Merritt, thank you. I want to acknowledge you at this time. And if you have any testimony that you would like to share with us, or feedback, we'd be glad to receive it.
Thank you, Ms. Wall-Lennon. Again, I'm Cheryl Merritt. I'm CEO broker of New Legacy Realty here in Raleigh. I have had some experience working with Wake County, their rental assistance program as a property manager. I'm registered there. And I'm going to say that I think possibly the reason I was able to have that contract was because the tenant was already in place at the time. And so it was just a matter of changing who the property manager was. I have not had any additional opportunities to work with the rental assistance program. I have received a couple of calls over the years asking if I had any rental properties available for potential tenants. But other than that, I haven't had any other experience. I do follow some of the RFPs that come out through Wake County, specifically the rental, anything that has to do with housing. And one of the challenges that I find is oftentimes they're always looking for nonprofit providers. And I'm sure part of that is because of where the funding is coming from. I think CDBG and some of the other HUD funds that come down from the federal government may require or limit these funds to only be available to nonprofit providers. But I think it sometimes is a disadvantage to those of us who are for-profit companies, because we can offer some of the same services and provide some of the same, projects, work on those projects, but we're cut out because we are not nonprofits. And so that's what I wanted to share. Thank you.
Oh, that's very helpful. And Ms. Harvey, if you don't mind, and I don't know if you're in a position where you can speak, but just for the record, I know you put that in the chat, but do you mind, are you able to come off mute? Because I think you echoed some of the sentiments that Ms. Merritt had indicated.
Yeah, she was speaking. I have run into that as well. And so just recently on auction.com, a lot of the houses there go through a program called First Look. And a lot of that is geared towards government entities or nonprofit organizations. So even to be a part of that particular market or platform, you have to be a part of a nonprofit. So just as Ms. Merritt was sharing, I've run into that as some of the obstacles and barriers as well, doing business all across the state of North Carolina.
Okay. Have you, may I ask a follow-up question? Have you had an opportunity to submit, as Ms. Merritt has, for any of the RFPs, or have you seen any of the RFPs that have come through from Wake County?
No, I have not.
Okay.
Mhm.
Thank you for that feedback. So the floor is still open if anyone would like to take this opportunity to provide your testimony in doing business or attempting to do business with Wake County.
This is Ray Miller with Adara Spa in Raleigh, North Carolina. I will say that I think I am in a unique position, and I say that because you don't know what you don't know. So me being a day spa, I've been unable to find the opportunity to work with the city. I know that I was applying for a grant, and I had to reach out to someone in Charlotte, and they said, oh no, you couldn't do business with the city because, you know, could you imagine what the press would be if you hear about people getting spa services on the taxpayers' dime? On the other hand, I've had people say, oh, it would be a great opportunity for there to be team building exercises and a group to come in and do team services. You know, you do services at the spa and it's a team building opportunity. So I have not had the opportunity where I've been able to find where my niche market is with the city. Now, there may be opportunities out there and I haven't seen them, but
Okay.
I definitely keep my ear to the ground, and I'm always looking for opportunities. I get letters from the city when they're doing bids, which are not in my preference of what I do.
Okay.
But I also get letters from different, you know, I try to stay in the different mailing lists and things like that.
Okay.
So I have not found the opportunity for my type of business. If
Okay.
it's out there, I'm not aware of it.
Okay. Thank you for that. So I have two follow-up questions. So was the grant that you were trying to get, do you recall if it was with the city or with the county, with the city of Raleigh or Wake County?
It was with the county.
Okay, so it was with Wake County for a grant
Mhm.
opportunity with Wake County.
Right.
And in terms of bid solicitations, I know you say that you're getting things from the city, and they may not be in your respective area, which you indicated, but do you recall if you get any type of bid notifications from Wake County?
I get all bid opportunities, and so as far as I can remember, because I can look at my phone really quickly, I'm pretty
Mhm.
sure they are from the county. But again, I'm sure that I don't fall in the scope of what they're looking for, because it's usually building, it's air conditioning, it's HVAC. So I'm
Okay.
pretty sure it's county.
And
And
now
I'm-
is just another clarifying question. Is it coming through the interactive purchasing, the IPS system?
Uh,
Oh,
I'm going to look while we're talking because I can't answer that. So when someone else is talking, and once I find that information or find a bid, I will let you know. Is that a deal?
Okay. Okay, yeah, sounds good. Thank you.
You are.
Just wanted to drill down a
Oh.
little bit further because we're talking
So I'm
about
looking at,
outreach and networking.
and I'm looking at one right now. So this is from the city of Raleigh, and that's where I get most of mine, is the city of Raleigh.
Okay. Thank you for
Okay.
that.
You're
Okay.
welcome.
Right. Very helpful. Anyone else haven't had any experiences with Wake County, as Ms. Miller indicated, in terms of different resource opportunities that you might be aware of that have come from the county? Any bid notifications, anything of that sort? Any of your experience regarding that? Ms. Ellis?
This is Mima Ellis. I have been a licensed family child care provider in Wake County since 2001. And I have been dealing with Wake County probably since 2000 and probably 2003 up until now, because I do have children that are
Mhm.
subsidized by the state of North Carolina and Wake County. And my challenge, especially probably in the last 5 years,
Mhm.
but no, actually longer than that, in the last 10 years, is that because we, and I'm speaking for family childcare homes, because we are family childcare home, sometimes we're not considered a business
Mhm.
because we're operating out of our homes.
Okay.
So that can also be a challenge. And also because the market, we have been fighting for higher market rates since I think since I've been doing family childcare. And just to give you a little background, I also worked in a center before I started working as a family childcare provider. And I do have a degree and I do have certifications for the care of children with special needs and also in the care of infant, toddlers, and twos.
Mhm.
And and I am a 5-star provider. But
Mm.
at the same time, I feel like because we're a very small business, and of course the city of Raleigh also limits the amount of children that we are allowed to have in our homes. And we've only had a market rate increases since 2000, maybe twice. And we just
Oh,
had
wow.
one this year. So and so in the last 20 years, the market rate has increased for family childcare providers maybe $100.
Okay, is that
Um,
$100 is, okay, so I want to make sure I understand the context. You're saying Wake County, since they oversee childcare, subsidized childcare, you're saying as a childcare provider that in the past 20 years, you've only seen where Wake County has provided a market rate increase twice. And is that
yes.
$100 per week per child, subsidized child, or $100 per month? What's the unit?
Okay, so the last market rate increase, which just happened and became effective October 31st, 2022, was $70. The
Oh,
one,
so
that's $70 per month. Yes, ma'am.
oh, $7 per month, okay.
$70.
So,
And
so are you,
I'm
go
sorry,
ahead.
and that rate is for a 5-star provider. That's not even for anybody that's getting less than that. That's for a 5-star family child care home. That market rate increase is $70.
So let me, if I can pause you right there. So what does that mean? So you're saying, can you explain that
I'm
$70?
Yes. So, and let me explain that market rate, the market rate for an infant in Wake County before this last effective market rate increase was $906. That includes the parent portion, because parents are required to pay 20% of their child care fee.
Okay.
Those are that employed. So if the parent is, let's say the market rate is $906. If the parent is paying $206 of that market rate, that means the child care provider is getting $700
from the county.
Right.
From the state or from the county?
From the county.
From the county, okay.
And so if you break that down per week and even down by the hour, we're not even making $5 an hour as a family child care provider. but we're required to keep up our license. We're required to be CPR and first aid certified. We're required to be certified in all these things, and we're required to do certain things, but the money is not matching the amount of
Okay.
work that we have to do as family child care providers.
So when you say that the last increase was October 31st, effective October 31st, 2022, and you're saying it was an increase of $70 a month. So based on the example you gave, it went, would that mean, for example, it went from $906 to $976?
Yes, ma'am.
Okay. All right.
Yes, ma'am. So it's
And
kind of been
then-
it's kind of been a challenge, and I'm not knocking Wake County, and I'm definitely not knocking the state as far as the Department of Health and Human Services and the Division of Child Development and Early Education, because they have been more than godsend since especially during the pandemic, when we had to send children and families home and all of that. So definitely, but at the same time, because of inflation and the cost of living and all the things that we have to deal with as family child care providers is stretching us real thin.
Okay. Could you elaborate, if you don't mind, a bit further about what you were indicating about the county? Because I do want to, where possible, and if it is one's experience, positive and negative, but you did speak about what the county did in regards doing, I think you said, did you say during COVID?
Yes.
Okay, could you speak to what that experience was
Well,
like, what they provided or did or didn't do?
Yes, ma'am. The county provided PPE equipment such as gloves, masks, cleaning supplies, things like that. During the pandemic, that was very helpful because we had COVID guidelines that the CDC required us to follow as childcare providers. And of course, that increase in expenditure for cleaning supplies, protective equipment, and that type of thing, it was very helpful. And also the American Rescue Plan Stabilization Grant was also very helpful in helping a lot of us stay open. Be it a center or be it a childcare center or a family childcare home. So it was very helpful in all of that. But it's but I guess I was a little bit disappointed in the market rate, that the very small increase in the market rate, and I do understand that families are struggling, and I do understand that that childcare is a big expense, but at the same time, for those of us who provide care for children and quality care for children, and really take our profession and our business seriously, that it's just not adding up, and it's causing for some of us to consider other options, and some of us are closing our businesses because we just can't. It's just too much. We just can't handle. We just can't handle all these challenges. You put out one fire and another starts. So it's like, it's hard. It's very hard. It's been very hard for a lot of us, because a lot of us, this is our only income. We don't have anything else, So I think it's very important that the state recognizes that childcare, be it a center or a family childcare provider that is licensed and maintains compliance of that license, that we be given more consideration, even for grants, for applying for grants, and there being more resources for childcare providers.
Okay. Ms. Ellis, thank you so much for that testimony and for that feedback. I appreciate that so much.
Thank you so much.
Okay, we are approaching the 2 o'clock time frame. I'm happy to stay on the call. Doesn't look as if we've had any other business owners to join us, but I do want to give an opportunity to Ms. Johnson and Ms. Indiritu, Ms. Georgina, in the event you all would like to provide a testimony, any testimony or feedback, comments.
Not at this time.
Okay. Ms. Georgiana?
Hi, I'd just like to support Ms. Ellis's conversation about the cost of operations, especially for family home care centers. The cost of even hiring like assistants and so on has also gone up because we're now challenged with getting employees who are working at places like Target and Starbucks. They're offered $19, and given that we have had a lower pay scale, it becomes very challenging to operate on those costs. So the state has assisted very greatly by helping with the subsidies that they have provided for us during COVID. And those subsidies will run out early next year. So next year when they run out, we won't know how we will manage to keep up the wages that we've had to provide for the teachers and plus the bonuses. So the challenge is real. When that happens, we don't know whether we'll be able to sustain not only home family childcare centers, but even, preschools at large.
Ms. Georgiana, just for clarification, so when you say that, when you gave the example about the hourly rate paid by Starbucks and Target, and how, that's a competition per se, I guess, for daycare providers. But did you indicate that the subsidies were coming from the state or from Wake County?
I believe they came, we got the application was through Wake County. Am I right, Miss Ellis? I believe they were. It was a federal funding.
Oh, okay.
Actually, those monies went through
They went through DCDEE, but it was a federal
Department of Health
funding.
and Human Services. So yes, the state.
When you say DC,
DCDEE,
what does that stand for?
Division
Division of Child Development
Development and Education.
Okay, and that's with the state.
It's a
Okay.
state-run organization. And that's the same one that she mentioned when she talked about all the requirements for licensing, CPR,
Okay.
and all that.
Okay. Do you know if the county provides any subsidies through the county?
The county will subsidize for students who need help through voucher systems. And that's the voucher system she was referring to, that they received the increase for the $70 that she mentioned.
Okay, so the county will subsidize for children.
Through the subsidy, which is a voucher.
Okay. Okay. Right. Okay, so just wanted to let you all know that we were wrapping up the public hearing. Ms. Cordelia has put in the chat that she put the email where you can email. And so if you all have any more questions or feedback, please feel free to email to wakecountystudy@gspclaw.com. All right, thank you all so very much. I appreciate you being on the public hearing, and we appreciate your interest and continue to just kind of follow along for the disparity study. Thank you. All right, everyone have a great day.
Thank you.
Bye-bye. Thank you.